Hi, everyone. It's really great to be with you here today. My name is Holly Harris. For the last 4 months, I've been fortunate enough to be in the interim health services director role. Prior to that, I was the behavioral health director for nearly 3 years, and I'm really excited for the opportunity to apply for the health services director position permanently. We wanted to record this presentation that I will be doing on Thursday for the staff meet and greet for those of you that can't attend. I'm grateful to already know many of you. I've been with health services for going on nearly 13 years. But for those of you that I don't know yet, I hope today's presentation gives you a sense of who I am and why I've applied. I've been asked today to share the following information. So to tell you a little bit about me, why I'm interested in this position, my vision for the department, and what I see on the horizon for health services. Okay, a little about me. I was born and raised in Texas and moved to Oregon about 14 years ago to be near my sister and her family. I have a master's in counseling and I'm a licensed professional counselor in Oregon. I've worked primarily in the public sector for most of my career, mostly local county government, but I've also done a variety of behavioral health work in the private sector, mostly with individuals who were justice involved. I started my 20-plus career back in Texas working at a domestic violence shelter for women, where I help support them in leaving abusive relationships, establishing legal protections, and really helping them rebuild their lives. This work instilled in me a passion to make a meaningful impact on people's lives and the community in which I was living. The intersection of this work with the criminal justice system was really pivotal for me and led me to years of work and service in that field, including becoming the director of a juvenile probation department back in Texas. It was there I really saw firsthand the things like ACEs and social determinants of health had on people's lives, which inspired me to want to do more to affect long-term systemic change for marginalized populations. My journey at Deschutes County began rather uniquely. I actually never imagined I would leave Texas or leave my job at juvenile probation, which I loved tremendously, but was really feeling a strong calling to have our family be closer together in Oregon so I could see my nephews grow up. It was a challenge to find employment during that time, as the job market was very different than it is now. But I did know that I wanted to work back in local county government, as that's where I felt I could have the most impact. So I took a part-time on-call position as a mobile crisis clinician, otherwise known as MCAT back in the day. This turned out to be the best decision I could have ever made, as it deepened my understanding of complex systems, fueled my passion for helping vulnerable high-risk populations, and I spent the next 9 years in the crisis program as both supervisor and then manager, and was really fortunate to be a part of the development and implementation of the Deschutes County Stabilization Center. I was most recently the behavioral health director for nearly 3 years, overseeing approximately 280 staff, a variety of behavioral health programs, including intellectual and developmental disabilities. For the past 4 months, as interim health director, I was really fortunate to get to immerse myself in some teams and programs outside of behavioral health, getting to learn more about what public health does behind the scenes, particularly around emergency preparedness with the flat fire, was incredibly eye-opening. Learning more about the communication to the public as it relates to vaccines and other important health information was also really incredible. Their work is broad and complex, and it was clear to me that the work they do is invaluable and often unseen. While I've worked closely with the admin service area in prior roles, it was an awesome experience to get to dive deeper into their work as well. My work with the HIT team and the fiscal team on broader health services topics were such a learning opportunity for me. I was able to see very clearly how we all fit together, and the admin service area is truly the glue. I know I've only scratched the surface in learning about the work of public health and admin, but I'm really excited to learn and grow even more if given the opportunity. Lastly, as you can see from my photo, when I'm not at work, I love spending time with my family and our 2 dogs and spending as much time as possible on all of the rivers and lakes that Central Oregon has to offer. Why am I interested in this position? Well, as some of you may or may not know, I didn't jump into this decision lightly or casually. When the recruitment first opened back in January, the timing really wasn't right for me. All of the federal information about possible Medicaid cuts was just starting to come out. Behavioral health had just embarked on some really important work to streamline and enhance our services, as well as the fact that we had multiple residential projects just starting to begin. After that recruitment failed to produce a viable candidate, I really began to consider whether I would be effective in this position and realized that I did have some skill sets and valuable experience that could lend itself well in this role. However, I still wasn't sure I would enjoy the role or be as fulfilled in the same way as I had been in the behavioral health director role. The thing is, I loved my behavioral health director job. In fact, I've loved every job before that. So it's really important to me to know that that not only can I be effective in a position, I need to know that it will fulfill me personally as well. I knew I wouldn't know this until I actually had a chance to try on the position for a period of time. But the timeline didn't really work out for that to occur by the time the second recruitment rolled out. When I was appointed interim health director in May, I was able to fully immerse myself in the position and truly get a sense if I was effective, if I enjoyed it, and if I actually wanted to do it. I found the experience incredibly rewarding and challenging, and I believe I am the right person at the right time for this opportunity. I enjoy problem solving. I enjoy complex challenges. I believe my years in the crisis system has given me an ability to navigate really chaotic and unpredictable situations well. I love working for health services. I want to see it thrive and continue to lead the state in the work that we do. So I can clearly say, yes, I want this position because I think it would be a chance to make a lasting impression on the community and support a system that will face some unique challenges in the next few years. I feel I'm ready for this opportunity. I'm invested in the health of this community and the people that work at health services, and would be honored to have the opportunity to lead this organization through the challenges and opportunities that lie ahead. So my vision for the department. What is my vision for the department? Well, in normal times, I would be talking about new projects to fill identified gaps, new innovative programs, and even expansion ideas to fill existing need. Despite the incredible work we do here, I do know that there are areas we would love to expand and a community need that still exists. But I have to be honest, the times we're entering into are different. There is fiscal uncertainty that may limit our ability to do those new things. So I feel I would be being disingenuous and a bit out of touch if I led with that. Instead, my vision for at least the next few years is really around finding creative ways to continue to do as much of the work that we are currently doing, to sustain as much of our current programming in its current form as possible. I want us to still be excellent in everything we do because that is what we are known for across the state. I still want us to lead the way in demonstrating how to do this work under different rules and expectations and innovate in new ways through collaboration with community partners. Creativity over capital is a new phrase I learned recently from our amazing project management team, and it really resonates with me, especially right now. Not every great solution requires money. Sometimes it just requires out-of-the-box thinking. And out of difficult and challenging times often comes new and creative solutions that can help us sustain the work for the long term in both fiscally sound and fiscally challenging times. That is my vision for us, to weather the storm with as minimal impact to staff and the people we serve as possible, while continuing to innovate in new and creative ways. In addition, I know we can't do this work without quality and healthy staff. The workforce efforts that we've begun and will be even more critical as we go into the next few years. So I have every intention of continuing those efforts, continuing to invest our time and energy into those efforts, and ensuring staff well-being remains at the forefront of what we do. What do I see on the horizon? What are these times that I keep talking about in my previous slides? Some of the challenges we may be facing are related to HR 1, which is the federal reconciliation package that recently passed that will likely have some important and impactful changes on the work that we do. There are many changes to Medicaid that could affect enrollment and our ability to generate revenue in the same way. Many cuts were passed that will have an impact on public health programs, which are primarily federally funded. We don't know the full impact of this yet, and we'll have to wait and see for some of it, which is really hard. We also don't know what Oregon will or won't do to mitigate any of this. What we do know is Oregon is also facing some significant budgetary constraints as well outside of the HR 1 impacts. So it seems likely we'll be facing some fiscally challenging times. In addition, new direction from the federal government continues to trickle down around important topics like diversity, equity, inclusion, houselessness, immigration, eligibility for services, among many, many others. And we're going to have to be nimble and creative as we learn what this means for our work. But while all of this can really feel confusing and sometimes scary at times, I'm confident in our ability to stay true to our mission and values as a health department. We are here to promote and protect the health and safety of our community, and that's what we're going to continue to do. With any challenge comes opportunity, and I see enormous opportunity for us to work collaboratively with our community and our community partners in new and innovative ways. As I mentioned earlier, it's a chance to think outside the box and learn how we can support and enhance each other's work, remove any duplication, find ways to streamline our services so they are as efficient and effective as they can be. We did some of this during COVID, so this isn't new to us, and we learned some incredibly valuable lessons during that time that helped us be stronger in some ways for the future. We can do this again, and I'm committed to turning over every rock and looking around every corner and seeing if there's something we've missed or a way we can be doing it better. And I'm up for the challenge. I know all of you are as well, mostly because I know the type of people that work here and the passion and commitment you all have to our community. Well, that's the end of my presentation to you all. Thank you so much for the opportunity and for taking the time to watch this. I mean it when I say that you all are a large part of the reason I applied. I know I'm biased, but I truly believe we have some of the most competent, hardworking, compassionate, and incredible staff around. I know there are a lot of places you could work, but you've chosen health services, and likely because you care about your community and the people that live here, and you want to be a part of making it even better. So thank you for what you do.